Good afternoon, everyone. Welcome. We will get started in a few minutes. All right. Good afternoon again, everyone. Thank you for joining us today. My name is Erica Crespo, Social Media Director for the Anticancer Lifestyle Program, and I am so proud to introduce you to Dr. Linda Carlson, the Director of Research and Clinical Psychologist at the Department of Psychosocial Resources at Cancer Care Alberta, and the host of today's webinar, Mindfulness for Coping with Cancer. Now, before I get going on my intro slides, I like to know that everyone can hear me okay so that you can follow along with the webinar. So if you don't mind typing in where you're joining us from today, the city, the location, the state, the country, that'll let me know that you can hear us. All right, I see Chicago and Santa Rosa, Fairfax, Virginia, LA, Norwalk, Connecticut, Calgary, where Dr. Carlson's joining us from. Love it. Thank you again for participating in that so we can move forward knowing you can hear us well. So please know that you can use the Q&A function to ask questions at any time. We will have a Q&A period with Dr. Carlson at the conclusion of her presentation. You will receive an email with the recording of this presentation once the event is through, and closed captioning is available in English. Welcome. If this is your first time joining us, we are the Anti-Cancer Lifestyle Program, and we offer free, doctor-recommended, evidence-based resources to help you reduce your risk of cancer, cancer recurrence, and chronic illness. If you haven't yet visited our website, I encourage you to check us out. We're at anticancerlifestyle.org. My friend Nicole will drop a link to our site in the chat. And not just like our webinar that you're attending today, we have a host of other free evidence-based resources for your enjoyment and education. Our ebooks are very popular. We release them at a very quick pace, so check out our ebook webpage because we release them every so often. So some ebooks you might be interested in if you're joining us here today, our Mindset 101 ebook, Learning How to Manage Your Stress. We have an anti-inflammatory diet ebook. It's the season of spring cleaning, so do it in a way that's going to better your health with our Detox Your Home ebook. And like I said, we have a plethora more where this comes from. This is just a sampling. Nicole will drop a link to our ebooks in the chat if you're interested. Again, they're all free. You also might be interested in joining our 7-day Mindset Kickstart. It's free. It's only 15 minutes a day. And over a course of a week's time, you'll join our program's mindfulness expert, Margaret Fletcher, on a journey of enhanced mindfulness, reduced stress. We cover topics like the anti-cancer mindset and the mind-body connection, and many more. So you can sign up for free, either on our website, or Nicole will drop a link to that in the chat. We have a private Facebook community group that's much more intimate than our public profiles you may or may not be aware of. If you'd like to join our private Facebook group to connect in a more intimate setting, please request. Nicole will drop a link to this group in the chat now. Your donations do make a difference. In case you aren't aware, we are a nonprofit, and events like this and all the resources we're able to distribute to you really help us improve the lives of cancer survivors, those going through treatment, and really everyone who's interested in healthy living. So if you're able to make a tax deductible donation, please know we so appreciate it. Today's presenters, we have Dr. Linda Carlson. My name is Erica Crespo, the social media director, and in the background is Nicole Jones, our program's marketing director. A little about your host. Dr. Linda Carlson is a clinical psychologist and leading researcher in mindfulness and integrative cancer care. She holds the Enbridge Research Chair in Psychosocial Oncology at the University of Calgary and serves as Director of Research at Cancer Care Alberta. Dr. Carlson has published over 300 research papers and co-authored the widely used guide, Mindfulness-Based Cancer Recovery. Her work has shaped global approaches to using mindfulness to support people with cancer, and she's a sought-after speaker, including a TEDx talk on mindfulness and collective evolution. We are so lucky to have her with us today. Dr. Carlson, take it away.
All right, thank you very much for that lovely introduction. Let me just get the slides up here. And thank you everyone for making the time to join us live today for this event. So I'm going to talk to you about mindfulness for coping with cancer, and we'll do a few exercises along the way, sort of practical things you'll be able to use going forward. So I'm going to talk to you around the larger field of integrative oncology. You may have been hearing this sort of terminology. So what is it? How does mindfulness and these other approaches fit? Just review the mix of 6, which I'm sure many of you are familiar with, again, to situate the mindfulness practices. Then I'll talk about what really is mindfulness, what do we mean by it, what are some of the myths, and talk about the mindfulness-based stress reduction, or MBSR program. Many of you may be familiar with, and then our adaptation of MBSR called Mindfulness-Based Cancer Recovery, so I'll review that as well. We'll do some practice throughout. One of the most popular practices we do in the Mindfulness-Based Cancer Recovery program are these breathing mini exercises, so I'll teach you a few of those, and let's get started. All right. So first of all, a little bit of definition. Oops, just one at a time. Here we go. So within integrative oncology, it's actually the current evolution of a field that was often called complementary and alternative medicine, or CAM, and you may have heard that terminology. So we need to better understand what we mean by complementary therapies versus alternative therapies, because the terminology has now changed to talk more about complementary and integrative therapies. So what are complementary therapies? They're interventions, products, and procedures that are not traditionally part of conventional medical care. But the key thing here is that they're used alongside conventional cancer treatments. So here we're talking about things like natural health products, vitamins or supplements, mind-body therapies like mindfulness or yoga or Tai Chi, different forms of exercise, physical activity, as well as nutrition, energy therapies, traditional medical systems like traditional Chinese medicine, Ayurveda. Those are all forms of complementary therapies when they're used in conjunction with conventional care. Alternative therapies, on the other hand, may be similar practices, but they're usually not evidence-based, whereas complementary therapies are more used in an evidence-based way, and they're used instead of conventional care. So a person might, instead of getting a recommended chemotherapy or surgery, they might say, no, I'm going to go to some clinic in Mexico or somewhere and pay a lot of money out of pocket for alternative approaches, which usually are not evidence-based. So within the field of integrative oncology, then, we're focusing on the complementary therapies that are used in conjunction with conventional care. So now that we know what we mean by complementary therapies, we'll do a little survey here. And if you want, you can pop your answers in the chat just to see where everyone's coming from. So what percentage of people with cancer use complementary therapies, like I just described them, after they're diagnosed with cancer? So would you say it's fewer than 10%? Is it more like a quarter of the people, half of the people, or all the way up to 3/4? So what would you say? I'll give you a minute to sort of put in some of those answers. Let me see them popping up. Oh, here they come. Well, I'm getting a mix, some 25s. Yeah, quite a few 25s actually, So some of you guys think it's pretty low. Interesting. Okay, well, let me tell you the actual answer. The actual answer is C, 50%. So here's some data, if I can get it to come up. I'm stuck. Hold on a sec. Oh, there we go. Okay, hold on a second. Okay, so when we look at research across the world, so this is a study from a decade ago, but actually the numbers still hold up. So in 18 countries, there was an average of about 46% of people using some form of complementary therapy. A later review of 61 different papers found around 51%. Some local data from here in Calgary was very similar. So we surveyed people, it was about 47% of people were using them. So across the world, there's variability, of course, among types of cancers. People with breast cancer, for example, are higher users. And we also saw in our data that women are higher users of complementary therapies, younger people, those who are more highly educated, and living with cancer for a longer period of time. The most commonly used complementary therapy is natural health products, and people are using them primarily to improve their quality of life, to sort of enhance their overall health through their immune system, help increase feelings of hope, and a few people are hoping that they'll help to cure their cancer. So I've been talking about integrative oncology. What is it really? It's a patient-centered, evidence-informed field of cancer care where we utilize mind and body practices, like I mentioned, The other complementary therapies, natural health products, lifestyle like diet and exercise alongside conventional treatments. So it's evidence-based, and we aim to optimize health, quality of life, and outcomes across the cancer care continuum. So right from the time of prevention to diagnosis, treatment, and empower people to prevent cancer and become active participants in their care, both before, during, and beyond cancer treatment. So I've got the little logo for the Society of Integrative Oncology. That's a professional organization that's also international that represents, we have patient partners, but also researchers and clinicians in the area. So as I said, there's the sort of three main areas. We talk about lifestyle modification, mind-body practices, natural products, but those are used based on a person's individual values, preferences, rights, beliefs, what they think is important to them, combined with the research evidence and also clinical experience of what tends to be helpful in certain different contexts. So under lifestyle modifications, we've got the exercise, physical activity, diet, and we consider sleep and stress management there too as foundations of wellness. Whether you're sick or not, everyone should be practicing healthy lifestyle. And then we have the mind-body therapies. I mentioned meditation. We'll talk about that in a lot more detail in a moment. But other things like yoga and acupuncture, tai chi, qigong are also fairly highly evidence-based and recommended for many different symptoms and side effects. And then we've got the vitamins, minerals, botanicals, herbs as well. So I'll mention the Anticancer Living book. I'm sure many of you are familiar with this and the mix of 6 protective factors. So we've got, you can see recurring themes, diet, activity. I'm going to talk mostly within the stress management area today. It also sort of taps into sleep or affects sleep. And then we've got love and social support, relationships, as well as those environmental toxins. So if you haven't read this book by Lorenzo Cohen and Allison Jeffries, I highly recommend that you pick it up. All right, so let's get into mindfulness now. So what is mindfulness anyway? You know, you hear it, it's very popular, it's a bit of a buzzword, everybody should be doing everything mindfully, but what do we mean by it? So for example, if you look at Time magazine, you might think that if you practice mindfulness or meditation, you turn into a serene, beautiful, young, blonde woman. Oh, how lovely. Unfortunately, that's not always necessarily the case. So we define mindfulness as paying attention on purpose in the present moment with an open and accepting attitude. So there's a few key elements there. Mindfulness is both a way of being in the world, so you can be more or less mindful no matter what you're doing. You can pay attention to washing the dishes or driving your car, or your mind can be somewhere else entirely. It's also a practice where we cultivate the skill of being more mindful. So here's an example. So this is a way of being in the world that's not very mindful because your mind is full of all kinds of other things that aren't in the present moment. The perfect example of mindfulness is your dog in the present moment. And here's just an example of mindfulness meditation where we set aside a specified time to sit and cultivate the skill of paying attention or being mindful. So if we're not paying attention in the present moment, what's your mind doing instead? And often I pause here and ask people, how many of you or what proportion of the time do you think you're paying attention to what you're actually doing? So how often are you mindful? And you can think about that a little bit. You might want to pop something in the chat. But how much of the time? Half the time, a quarter of the time? How often are you actually mindful? I'd be interested to see what people are saying. Not enough. That's funny. Low, half, 20%, 50%. Yeah. So people are aware that often their mind is wandering and they're not actually paying attention in the present moment. Well, people have done studies on this, and it turns out we have anywhere from 50 to 70,000 individual thoughts every single day. It's a lot of thoughts, right? And so if you kind of ping people throughout the day and ask them, what are you thinking about? Or what are you doing? What are you thinking about? And how are you feeling? It turns out that a number of you were bang on about half the time. Half the time we're not in the present moment, our mind is wandering to something else. And the really interesting thing is that when people report being mindful or paying attention in the present moment, they report being happier, no matter what they're doing. So just that alone kind of can blow your mind, right? If I just pay attention to what I'm doing, I'm going to be happier, even if I'm doing mundane tasks. Why would that be? Why would that be? Well, where does your mind go if you're not paying attention to what you're doing? There's sort of two main places that minds tend to go. One is in the past. So maybe like this guy, he's thinking, oh man, why did I do that or say that? Or if only this, or if only that, or shoulda, coulda, woulda. And man, I'm really sad about that. And I have regrets. And maybe I'm a little angry at someone who did something. So he's in the past. He's ruminating about stuff that you're never able to change. And that causes feelings of depression and anger and regret. Or you're like this woman, right? She's racing off to the future. Oh my God, how am I going to do it all? What? I don't know what's going to happen. What about this? What if this? What if that? How am I going to get it all done? And she's stressed and anxious and getting really worked up, right? So our mind's in the past, our mind's racing off to the future. We miss the present moment, which is when we actually live our lives. So the idea with mindfulness is just to learn how to be more in the here and now rather than yesterday or tomorrow. So it's very simple, the concept of mindfulness, but it's not always really easy. So let's break it down a little bit into three components. So we call this the IAA model: intention, attention, and attitude. And really, intention is the why. Why do we want to become more mindful? Why do we want to practice? In the simple definition, we state that we do it on purpose. It doesn't always happen automatically. So we have to make an intention that I want to learn to be more mindful. Why? Because I want to be awake and aware for my life. Maybe I want to manage symptoms. Maybe I want to engage more with people in my life. Maybe I want to transcend worries of death and dying. There's lots of different possible applications or benefits of mindfulness, but we need to have an intention that keeps us motivated. The second component is really the core. What do we do? We're learning how to pay attention. It's a skill. We're developing the skill of directing our attention where we would like it to go, rather than just being taken on a ride wherever our thoughts decide they want to go, to the past or the future. So like any other skill, like playing piano or a game of tennis, you're not a concert pianist just because you listen to music, right? You become a concert pianist when you practice your scales every day and you're doing the actual activity, the practice. You're doing serves in tennis over and over again. The same is true of mindfulness. We have to sit down and do the formal training in mindfulness meditation. There's many different approaches to build the strength, the skill of paying attention. How do we do it is equally important. We need to be open, accepting, kind, self-compassionate, because it's challenging and sometimes can be frustrating when you first try to pay attention and you realize your mind is hijacking your attention. So we need to really practice being non-judgmental, accepting, and kind to ourselves when we do this kind of practice. So those are the three components. Now let's dig in a bit deeper to the attitudes. So here's a list of different attitudes that support mindfulness. There are many others, but let's maybe just review these a little bit. Non-judging. So the first step in non-judging is to become aware of the fact that we're almost constantly judging. And by this, we mean saying something's good, something's bad, I like it, I don't like it, I want it to go away, I want more of it. So this judging, if you pay attention when you have a judgment that I don't like something, then it has downstream effects for your experience in the moment, right? For your moods or the way that you're feeling. So letting go of the judging and just allowing things to be as they are is helpful. The next one, patience. We're in this fast food society where we want whatever we want it now. I want to relax and I want to relax now, but learning a new skill takes time. And sometimes we have to just take a deep breath and allow things to happen on their own time and quit trying to control a natural process so much. Acceptance is a tough one when you're dealing with cancer because some people think it means just giving up and saying, well, there's nothing I can do. But it's actually the opposite. Acceptance is seeing things as they are, honestly, without denial. Yeah, maybe I'm in a bad spot right now. I'm really feeling sad or angry or I'm really scared. That's okay. We can accept that as our starting point, explore it with kindness, and eventually we'll move beyond it because the only certainty in life is change. And that brings us to letting go. We try to control things that we have no control over. And so the wisdom of recognizing what we can and can't control and letting go of the need to try and make things be a certain way is very relieving. It's letting go of a lot of that holding and that tightness. So the same as non-striving. Non-striving is, again, just letting go of whatever it is we think we're trying to achieve and just being in the moment. Mindfulness is really just about being a human being rather than a human doing, right? And trusting our own basic wisdom and goodness. And beginner's mind is seeing things as if for the very first time. You know, it's spring now, the blossoms on the trees, the flowers starting to come out, just opening up to what's there in the moment. And so we often joke that, well, you might not like these attitudes, but what's the opposite, right? The opposite is that you can be a judgmental, impatient, rejecting, grasping, striving, suspicious know-it-all, right? Maybe that describes someone you know, or maybe that's you. Well, it's not a nice way to live. It's basically a recipe for stress, right? So these are the types of mindfulness attitudes that we want to approach the practice with. As I said, there's lots of misconceptions around what mindfulness is and isn't. So mindfulness is not the same as relaxation. Although you may feel relaxed in a mindfulness practice, it's about awareness of everything that's occurring. It's not hypnosis or some sort of goal-oriented practice that's around absorption or, you know, somebody else hypnotizing you. It's not a form of prayer or religious practice, although it's taught secularly in these programs, but anyone can incorporate it into your religious or traditional practices, whatever they might be, your spiritual practice. So it's very adaptable. It's also, and this is maybe the biggest myth, is that it's clearing your mind of all thoughts. Your mind goes blank. No, it's paying attention to whatever thoughts are already there. It is true that as you sit quietly and pay attention to, say, the breath or the body, sometimes the mind settles down a little bit, you know, the chirping may stop a little bit, but that's not the objective. So it's not always peaceful and calm. It's just about paying attention to whatever is happening with those attitudes of acceptance and kindness. So why would mindfulness be useful for people going through cancer? Well, people in general. The only certainty in life is change. The unwillingness to acknowledge and act upon this reality is thought to be the root cause of all suffering, is pretending change isn't inevitable. And so mindfulness helps us face and accept the inevitability of change. We use a lot of poetry in our mindfulness programs. This is one of my favorites from Thoreau. You may know it. I went to the woods because I wished to live deliberately, to front only the essential facts of life, and see if I could not learn what it had to teach, and not, when I came to die, discover that I had not lived. Right? So it's waking up to the beauty around you in every moment, every day, and really not taking for granted the days that we have ahead of us. So now is a good time to do a brief practice of mindfulness. We've been talking about it. Let's do it. So maybe just checking your posture, see if you're sitting in a way that's comfortable to just breathe easily. And we're just going to pay attention to breathing. So you might want to take one hand and place it on your chest so you can feel movement in your chest as you breathe. Take your other hand and place it over your your belly or your abdomen. And don't worry how big it is. Just let go of any judgment there. And we're just going to pay attention to breathing. So not changing breathing, maybe not judging breathing, just following the breath. So if you want, you can close your eyes or just have a soft focus on the nice wave there and just begin to notice your breath. And you can feel movement in your body. So as you breathe in, notice where you feel movement, how long that breath is. And as you breathe out, same thing, noticing the length of the breath, the transition of the breath from in to out. Is there a pause? Is one part longer than the other? Is your chest moving, your belly moving? Is it one or the other, a little of both? Can you perhaps notice tension in your body? Check the jaw, the neck, the shoulders. Is there tightness in the belly or your legs? Just being like a breath detective. What can I notice? Is the flow of breath smooth, or are there pauses, stops and starts? Can you notice perhaps your heart beating? Or maybe your stomach's gurgling? Maybe there's some discomfort in your body, just noticing with acceptance. And maybe your mind's wandering. If it's doing that, just making a note of where it's going. Is it going to the future, the past? Is it judging? Come back to the breath for just a few more breaths. Again, not trying to change the breath, but just noticing if any changes do arise as you're paying attention. And now lowering your hands, gently opening your eyes if they were closed. So if I was in person, I'd ask, so what did you notice when you were paying attention to the breath? Maybe people can just put in the chat a few things you noticed. Where was there movement? Was it the upper hand, the lower hand? Did you notice any changes? My breath naturally slowed as I paid attention. Could feel tension in the neck. Some tears, perhaps. Breath slowed down. Yawned a few times. Yeah, for sure. Calming. Change included smoother breathing. So, the interesting thing, and I said a few times, try not to change your breath. And maybe some of you listened and you didn't try and change it. And what you may have noticed, and some people put in the comments, is that your breath just naturally finds a happy place, a balance. So your body knows what's a good pace of breathing, what's healthy to provide balance to you. And if you get out of its way and actually just pay attention, the breath tends to become more even and more slow. And people often report feeling quite calm and relaxed just from paying attention, not trying to change anything, but just coming into the body. And you may have noticed tension or discomfort, which you can then also choose to release on an exhale. So let's carry on here. So I want to let you know about the mindfulness-based stress reduction program, which is sort of the foundation of a lot of this work. And this MBSR program was developed way back in the 1970s now, like 45 years ago, by John Kabat-Zinn, a fellow in the States in Worcester, Massachusetts. And what he did was he was trained in meditation, and he made a structured 8-week group program that combined intensive daily training in meditation and gentle yoga with sort of stress reduction techniques. And he wrote this book, Full Catastrophe Living, that really walks you through the whole thing. It's a great book if you haven't read it. Well, since that time, that MBSR model has been applied across the states, actually around the world. There's thousands now of MBSR teachers that are certified to offer these programs, and thousands of research papers that have looked into its effectiveness for physical and psychological disorders and symptoms. There's an organization called the American Mindfulness Research Association that has all the library of all the research papers if you're interested in that way. And actually, I'm going to show you here the number of research studies. So this graph actually just shows papers published in scientific journals about mindfulness, in case you're wondering, is there an evidence base for this? There certainly is. And so you can see up to the year 2000, there was just a few published every year. It wasn't a big thing. But then it really took off, the scientific study of mindfulness in the zeros and especially in the tens. And these numbers, you might not be able to see them, but it's 1,400 papers published in 2022, I think that was alone. And these are just in scientific journals. So our group started working in this area in the year 2000. It was when we published our first study of people with cancer, and it was actually the first in the scientific literature that looked at mindfulness practices for people with cancer. And so I'm going to tell you a bit about some of that work. All right, so that question again, why would it be helpful for people with cancer? Well, let's think about the illness experience that you're all going through. one of the fundamental components of it is this loss of control that I've spoken of. We often think we have more control over our lives and things that happen than we really do, but getting cancer often highlights how much of that is really not in our direct control. There's a lot of uncertainty around that. And of course, the life threat, right? Nobody can be diagnosed with cancer, no matter how good the prognosis, without thinking, oh, this could take my life earlier than I thought. I need to think a little bit about what that means to me. What are my fears around that? What would be the implications? So that can be very scary for many people. There's loss of certainty and predictability and routine, right? You may have thought, you're going to work, retire, do all these different things in your retirement. You may have to take time off work. It can really throw everything up in the air with scheduling and all that kind of stuff. So even that, just throwing off your routine and the predictability in your planning. Many emotions come up, grief, loss, fear, anger, self-blame, shame, depression. There's so much going on in terms of the emotional experience. And then there's the symptoms related to cancer and its treatments, like pain, fatigue, super common post-treatment, sleeplessness, this fear of cancer recurrence. So often after treatment is finished, no matter how good the prognosis, for many people, they're always waiting for the other shoe to drop, right? Every ache or pain or symptom gets them worried. And we can talk a bit more about that as we go through. It just turns out, though, that the skills you learn through the mindfulness program, we learn how to regulate emotions and those attitudes around acceptance, non-attachment, as well as self-compassion, tap into all these features of the illness experience in different ways. So the beauty of the mindfulness program is that it helps people with a whole range of different struggles and difficulties and challenges, and may actually shift what you're using mindfulness for over the course of your experience or your cancer journey. So we created this mindfulness-based cancer recovery program back in 1998. And it started in 1996, actually, before I even came here. Oh, and by the way, behind me is our brand new cancer center it's called the Arthur Child Comprehensive Cancer Center here in Calgary. Back in 1996, we were in a much smaller building, and some of my colleagues got to talking about how, they use meditation and yoga to cope with things in their life. Why aren't we doing something like that for people that we're working with in the cancer center? So it was based on their personal practice. And I was a student getting my PhD when I first learned about John Kabat-Zinn and met him. And learned about MBSR. So I showed up in 1997 and I said, oh, that's so awesome. There's this MBSR thing. We really need to do that. And so we began adapting from the MBSR model and combining things from other people's personal practice and making adaptations for those specific challenges of people with cancer. So our program has been free, open to anyone with cancer, their family members, since 1998. We run it a few times a year, 3 to 9 times, with groups of 15 to 20 people at a time. So we do the math. We've had a few thousand people through since then. And so we've done a lot of research within our clinical program. So we'll embed the research studies in the groups of people who are going through the program. So it started as an 8-week intervention. Now it's 9 weeks, up to 2-hour weekly meetings. We typically have 2 instructors, and it follows a similar format every week. So we have a short introductory meditation. There's a discussion, often around home practice. There's some teaching material, and then we do a series of yoga postures or mindful movement, followed by a series of different meditation practices that we learn. So we give a booklet to everybody. It's got space for them to record their home practice, reading materials. There's a bibliography. And we give people, well, we used to give them CDs. Now they have links to sort of streaming MP3 tracks that they can listen to. So they can keep track of how much time they spend doing their practice. And we have a silent retreat near the end of the program between weeks 6 and 7, which is actually the same as the traditional MBSR program. So it's a multi-component kind of program. The overarching theme is mindfulness. We're learning different ways to be mindful. We teach people specifically how to do relaxation and abdominal breathing if they want to bring down their level of tension or anxiety. We use the yoga as a mindful movement practice to reconnect with the physical body because everything is so embodied in terms of our thoughts and our feelings and our emotions. We talk a lot about the mind-body connection, both the physiology of it and the applied ways we can use our knowledge of the mind-body connection to, in the moment, cope with different things that arise. We use visualization and imagery. A little bit cognitive coping that comes from cognitive behavior therapy, looking at the stories we tell ourselves, and then the different sort of ways that we might say catastrophize what's happening in the world, how we interpret things. There's this element of personal empowerment because people are learning things that they can do to control how they feel and how they respond to their environment. And there's lots of social support because it's done in a group and people really appreciate being with other people who understand what they're going through. So there's lots of different types of meditation practices we do. I've got pictures of them. So that's a body scan. They're not napping. They're actually paying attention to one body part at a time. So very slowly going from toes, maybe right up to the head, taking 20 minutes, checking in with each body part, learning to detect sensation, tension, all kinds of experiences that you may feel in different body parts. Sitting meditation, you're not having to sit like a pretzel on the floor with your leg wrapped around your neck and just sit comfortably in a chair. Pay attention to breathing. Walking meditation is another practice that's traditional that we do. We use sort of visualization or imagery, for example, the image of a mountain or a lake, and we cultivate self-compassion through loving kindness and also compassion for others. I mentioned the gentle yoga as being a really important part of the practice, and that's a way to embody our mindfulness and reconnect with the physical body, that may be quite different during or after cancer therapy. People may have scars to deal with or discomfort or pain. And so really learning to read the body and respond in kind ways to what the body is telling you is a really important part of the practice. So we've written a book called Mindfulness-Based Cancer Recovery about this program. It's in a bunch of different languages. It's patient-centered, so it's basically a step-by-step guide for people to go through the MBCR program if you don't have access to it in person. So that can just be bought online. And as I said, it's in a whole bunch of different languages, has scripts that people can follow. So it's a good alternative if you can't get there in person. I'm going back to the components now because I want to show you an exercise around the mind-body connection that we use in the program that a lot of people find very helpful. Okay, so hopefully you can see this. So this is what we call the downward spiral in automatically reacting to stress. So I'm going to talk about the fight or flight reaction that we have when we interpret something as stressful in the environment. So the very first part of this is that there's stuff that happens, external stress events, stuff that happens in the world. We can't control those. The first piece is your perception and appraisal. Oh, that's no big deal, or this is a threat to me, right? So the minute we perceive something as threatening or stressful, we have that fight or flight response. So the stress reaction, it's parts of your mind, your brain, called the hypothalamus, the pituitary glands, the adrenals in the body. They secrete different hormones that causes that feeling of fight or flight. So you've got the racing heart, the sweaty palms, the butterflies in your stomach, the tension in the muscles. That's caused by this cascade of different hormones and neurotransmitters that happen the minute we decide something's threatening to us. And so we get this, what we call acute hyperarousal. So your blood pressure goes up, your heart's racing, and you are ready to kind of, fight the threat. So we often use the example of, hundreds and thousands of years ago, it would have been like a saber-toothed tiger or some very concrete threat. So your body's mobilized, you fight the threat, it runs away, and then you get to calm down. But in modern society, the kind of threats that we perceive that still trigger that fight or flight response are things like the cancer diagnosis, worry about the treatment, an argument with your spouse, difficulty at work, fighting with your teenagers, right? So they're not things that we can easily respond to. And so they tend to just get what we call internalized. You just press it down and keep going, and so what happens there is when we internalize it is that it never turns off the fight or flight response. So we're always in this state of reactivity or like activation. And so when we do that, it's internalized, it can dysregulate some of our systems because they're not supposed to be on all the time. They're supposed to go on and then they're supposed to go off. So we get things like hyperarousal, high blood pressure, heart arrhythmias. It can contribute to insomnia, sleep disorders. What else we got in there? Headaches, backaches, chronic anxiety. Well, then we feel rotten and we try to cope, right? But often our coping strategies are not that helpful or they're maladaptive. So we might do self-destructive behaviors like drinking too much alcohol, working too hard, trying to stay busy, using these different substances, drugs, alcohol, caffeine, food, because it makes you feel better a little bit in the short term, but in the long term, it has these negative consequences and keeps you in this loop. So eventually there can be this breakdown, psychological breakdown, physical breakdown. And depending on your predispositions for different illnesses, you may be predisposed for depression or anxiety or for heart disease or diabetes or even cancer. And so I'm not saying that stress directly causes cancer. I'm saying that there are many factors that contribute to risk for disease. The cancer biologists don't even know what causes cancer. But we do know that stress can be one of those puzzle pieces that adds to the burden. And mostly we know that if we learn to manage it, we can definitely have a better experience going forward. So this is kind of what we call the bad news, the downward spiral. So leading to this breakdown. So, if you keep building stressor on stressor on stressor, you never learn to really respond in a mindful way. So this is the flip side. Rather than automatically reacting, we're mindfully responding to stress. So you'll see there's still external stress events. We don't turn off the world, right? Stuff is still happening. But the very first step of perception and appraisal, we can reconsider. Are there other ways to think about this? We may still have the stress response, but with the mindfulness, we can look at our thoughts and feelings, right? We can look at our appraisal. We can have awareness of tension in the body, and we can use all the techniques we've been learning in the program, even that simple breathing exercise I did. So we can learn relaxation. There may be arousal, but there's an awareness of muscle tension, awareness of the breathing, and awareness of a fuller context. And then as you go through a mindfulness program, you're learning a number of different strategies that are focused on coping with the emotions, problem solving, seeing new options. So there is a quicker recovery to a state of equilibrium or balance after a stress response. And so you can overall have more calmness and balance of mind. So that's just to give you an idea of some of the models here. Now, we've been doing lots of research. I'm only going to show you one slide. That's it, one slide of research. But just to let you know that there is a lot of evidence around mindfulness-based interventions for people with cancer, showing that it improves symptoms, so stress, muscle tension, all different kinds of sort of sub-samples of stress symptoms, improves your mood. There's less anger, less anxiety, less depression. People sleep better. People feel less fatigued. They tend to ruminate less on the past, worry less about the future, and all the family members and partners who have participated show similar kinds of benefits. Not only does it help manage symptoms, it can help people thrive and cope in even more expansive ways. So improving overall quality of life, helping people feel more connected to something larger than themselves. This post-traumatic growth is around using a difficult experience to reconsider your priorities, what's important to you, what brings meaning and purpose in life, improving overall mindfulness, self-transcendence, and self-growth. And we poke and prod people along the way, and we know that it gets into the body. So the mindfulness practice can decrease high blood pressure, it can affect your stress hormones, it can affect your immune system and your inflammation. It can even get to the level of the DNA and affect cell aging. All that's there in the scientific literature if you want to ask about it or explore further. So there's barriers to face-to-face participation. Most of the research and the programs were in person. We know not everybody can attend in person. Not everyone has the time or the cost to take time off work or for childcare, lost salary, transportation. And sometimes you're just too tired to go to all the trouble of going to a program. And people may be concerned about immunosuppression and catching bugs when they go in person. And COVID-19 really made the imperative for virtual groups. So there's many virtual mindfulness programs now available. Our own group has developed an online mindfulness-based cancer recovery program. There's a couple of places it's offered online. So out of a nonprofit called Wellspring in Canada, the Singapore Center for Mindfulness has recently started offering it. There are individuals in the States who are offering it. Some cancer centers have it. If you can't get MBCR, an MBSR program is still really, really good, although it's more general. We've developed a mindfulness-based cancer survivorship app based on our program. We're actually right now in the middle of a study across Canada where we're testing out the app to see how it is. For people, we're still recruiting, but you have to be in Canada. So if there are any Canadians who are post-treatment survivors, you want to try the app, you can do it through the study. Once the study's done, it'll be more widely available. We've also done some work on virtual reality to kind of kickstart meditation practice using these headsets. And specifically, we've done that for people with chronic pain post-cancer. Okay, this is a little bit more about the app. So we basically took our program, we recorded a bunch of teaching sessions. They turned it into an app that's 27 audio tracks, and they're locked, so you have to go through them in order over the course of 4 weeks. But I'm actually not going to go through the video just for the interest of time because I want to do some more practices. Okay, so for the rest of the session, we're going to learn a few more breathing practices. Now, the background to this is understanding our autonomic nervous system. So first of all, let's just distinguish between voluntary and autonomic. So our voluntary nervous system controls things that we do on purpose. Like I'm going to raise my hand, you think I'm going to raise my hand, goes through your nervous system and you raise your hand. So that's kind of voluntary. We do it on purpose. There's also stuff that happens automatically that we have no say over. So for example, we don't have to remind our heart to beat. We don't have to remind our, liver to detox or our kidneys to do their work, our hormones to be secreted. So those are all controlled by the autonomic nervous system. Now, the autonomic nervous system itself, so the big A, is broken into two arms. So you can think of it like a seesaw. So there's our autonomic nervous system. On one side is called sympathetic. Now that's what we talked about, the fight or flight. So that's the sympathetic arm. So when fight or flight is activated, it goes up. And when it goes up, the relaxation side, the parasympathetic, automatically goes down. It's suppressed. And so we want to kind of come back into balance. Right? That's the healthiest thing. So the parasympathetic is the relaxation, the sympathetic is the fight or flight or the activity. Ideally, through the day, we want to have more of a balance between sympathetic and parasympathetic in our autonomic nervous system. And there may be times when we want more of the sympathetic activation and more of the parasympathetic relaxation. So that's just the background. And the really cool thing is that there is a way, even though it's happening automatically, there is a way to adjust the balance of our autonomic nervous system, so sympathetic and parasympathetic, that we have control over. What is it? I would ask you if we were in person, many of you would know, it's the breath. The breath happens automatically. We don't have to remind ourselves to breathe, thank goodness, but we can also consciously control our breathing. So the cool thing here, and I would ask you again, which part of the breath, the in or the out, do you think is associated with energizing versus relaxing? And it's right here in front of you, if you can figure out this diagram. So what it's saying is that when you breathe in, it speeds up your heart rate and it's more energizing. When you breathe out, it slows down the heart rate, the breathing, and it's more relaxing. So think about that for a second. You breathe in, for example, like when you're stressed or anxious or worried, what kind of breaths do you have? You have like short fast breath. Like you're breathing in a lot. And when it's all done and it's time to relax, a big long sigh, perhaps. So we can take that knowledge of in breath, more energizing, out breath, more relaxing, and adjust the way we breathe to adjust the way we feel, to adjust the balance in our autonomic nervous system. So we do these in the class. They're called mini breathing exercises. You can do them anywhere, anytime. You can have your eyes open or your eyes closed. They don't take long. And so the first couple are balanced. It's to seek balance between the sympathetic and the parasympathetic. So let's do one. So this is called the wave of breath, riding the wave. And so the way we do this is we want to sit upright so that we can sort of breathe quite deeply, quite fully. And you can close your eyes or maybe just follow the little wave on the diagram. And so as we breathe in, we're going to count up to 4. So breathing in, 2, 3, 4, and then out, 4, 3, 2, 1, and then continuing on. So imagining a smooth wave. The thing with this is that it takes a bit of time to get to a comfortable breath where you can include that count. So it doesn't have to be 4. It could just be 1, 2, 3, 3, 2, 1. We want the breath to be deep, but not forced. So comfortably deep. If you recall from the first exercise, maybe your breath came to that place just by paying attention. So trying to use that imagery or that visualization of the wave. So 1, 2, 3, 4, and then 4, 3, 2, 1. So just try it a little bit. Try to find a good pace for you. If you're feeling lightheaded or dizzy, just stop doing the controlled breath and let your breath go back to natural. And notice that you want to soften in through the belly when you're doing these two. Okay, so that's the wave of the breath. Another one you can do that's balanced is called a square breath. And the idea here is that we're going to pause, add in a pause, both at what I would call the top of the breath after you breathe in. So breathe in, say for 4. When your lungs are mostly full, you pause and you hold for, it could be 2 seconds or it could be 4. So if it's 2, you're making like a rectangle. But say you breathe in for 4, you hold for 4, and then you breathe out for 4. And then when your lungs are mostly empty, you pause there as well for however long is comfortable. So 2, 3, 4, whatever. So you're tracing the form of a square or a rectangle as you breathe. So let's give that a try. And some people find the holding a bit uncomfortable. And one tip is to be like 80% full or 80% empty of your lungs when you have that pause or that hold. And then when it's comfortable, just extend the pause a little bit. Okay, and that one takes a bit more practice to get used to, but I would ask if you noticed that it felt different pausing with your lungs full versus with your lungs empty. And you can reflect on that if you want to pop something in the chat. I guess the question is overall, how did it feel? And was there a difference between pausing with lungs full versus pausing with lungs empty? Time for a nap. Lungs empty hearted. Okay. Let me go back. So what we're doing there, oops, sorry, I went ahead. So if we think about what we're just talking about regarding the in-breath and the out-breath, so oftentimes the pause with your lungs full is a bit more uncomfortable because your heart rate is elevating. You might even feel it. And so it's a little bit more arousing or activating, pausing at the top of the breath. So it's like extending the in-breath, basically. Pausing at the bottom or after the exhalation is like extending the out breath. So it tends to feel more calming, quiet, and relaxing once you get a hang of the rhythm. And so that's what feeds into the last 2 breaths. So this one is a relaxing triangle. And so we only have the pause after the out breath. So basically, you're breathing in for 4, out for 4, and then holding for 4. So that 2/3 of the triangle is emphasizing the exhalation or the relaxing part of the breath. So you could give that a try if you want. So the idea is making that triangle, breathing in, going right into the out breath, and then just pausing or holding after the exhalation. So maybe give that a try. I love that. I could do that all day, but I know we're a little behind time, so we should move on. So that's the relaxing mini, we call it. And we'll end bringing you up a little bit with the invigorating triangle. So it's like the upside down triangle. And it's the opposite idea. So we breathe out, we breathe in, and we're just having that pause or that hold with the lungs mostly full after the in-breath. And when would you want to use these? You know, who wants to get themselves jacked up? Well, if you're really tired. I use it when I'm driving on the highway. I start to feel drowsy. I can do this kind of breath and it perks me up a little bit. So let's try that. So it's out, in, and then pause or hold with your lungs mostly full, just for as long as feels good. All right, so hopefully you got a feel for that. If you were doing this in practice, you can do it for as long as you want, but 5 or 10 of them, you know, when you're sitting in traffic or you're in a waiting room or any situation where you've got a moment and you want to calm down or sort of even out your level of regulation, they're useful. So I'm just going to summarize then. We talked about mindfulness being present moment, non-judgmental awareness with acceptance. We know it's a way of being in the world and that way of being is cultivated through learning the skill of mindfulness through regular practice. There's programs like MBSR and MBCR that train people and help decrease a range of different symptoms. And we know that mindful awareness can help people cope with everyday stressors. So hopefully you'll get a copy of these slides. There's a number of resources. How can I get started? Well, you can think about responding mindfully to stress rather than automatically reacting. So taking a pause when you start to feel stress symptoms and asking yourself, are there other ways to look at the situation? Can I use some deep breathing or relaxation? Use those mini breathing exercise. Remember the attitudes we went through. And there's a number of resources out there. So there's free mindfulness training apps. There's free websites that have guided meditations. You'll hopefully get a hand on these resources afterwards. I'll mention the Society for Integrative Oncology, whose mission is to advance evidence-based comprehensive integrative healthcare. I'm not sure if there's healthcare providers in the audience. There's also good information for people living with cancer on the website there. I'll put in a plug. I'm the past president of SIO, so I'll put in a plug for a conference that's coming up in Boston this fall. And if there are other healthcare providers in the audience, there is an MBCR facilitator training program that Michael Specka and I run. It's largely on-demand online program. And I'll pause now for the Q&A. I've also got some contact information where you can find more information about mindfulness-based cancer recovery, some free guided tracks that we provide as well, and my contact information. All right, I will stop there. Thank you.
Thanks, Dr. Carlson. That was invigorating and relaxing and so educational all at once. Thank you, everyone, for listening and participating. We had quite a few questions come in advance of the webinar and live, so I am going to get to it. Dr. Carlson, what are some of the best coping practices for extreme fear and anxiety, anxiety that has become paralyzing and overwhelming?
Well, I guess 2 things I would say here. So if the anxiety is that extreme that it's paralyzing and overwhelming, probably seeing someone for one-on-one counseling just to get at the root of that would be a useful thing to do. So many cancer centers have oncology social workers or psychologists or counselors that you can get an appointment with just to sort of look at that on an individual basis. Kind of more generally for managing just anxiety in the moment, using some of the breathing strategies or relaxation exercises can help. You know, I know for a lot of people, what's causing the anxiety is like worrying about symptoms and cancer coming back, the whole fear of recurrence thing. And so one thing that we always talk about in a mindfulness program is this spiral that people can get into, and maybe it's worth talking about, right? So what happens is you get an ache or a pain or it could be a benign symptom, right? It could be anything. But then your mind goes, oh my God, I wonder if that means cancer's coming back, right? And so then you start poking and you're like, yeah, it hurts there. Something's going on. Yeah, it's getting worse, right? And then you have these thoughts like, yeah, that definitely means it's back. Oh no, it's going to be terrible, much worse this time. And so there's this downward spiral of thoughts, and then your body gets really tense, and then the symptom gets worse, right? So the first thing to do is to try and decrease the tension around the symptom. And so what we often sort of negotiate with somebody kind of a plan, right? It's like, okay, maybe this is a symptom that you need to be concerned about, but give it, say, 48 hours, 2 or 3 days. And while you're waiting to see if it persists or if it gets worse, do some of these breathing or body scan or mindfulness exercises that will decrease the tension and the arousal, and hopefully also some of the worry, because that's often what makes it escalate. Right. So that's sort of a quick trick is to, say, okay, I'm going to wait a couple of days. I'm going to do a whole bunch of different exercises that'll bring down the tension and the stress and the arousal and see what happens with it. There are also, I might plug, standardized evidence-based programs for fear of cancer recurrence that are available. So there's one called Fear of Recurrence Therapy, or FORT, for example.
That goes into my next question. Is there any data that supports that stress management reduces risk of cancer recurrence?
That's really hard data to come by, just methodologically, to actually take people who go through our program compared to people who are more or less exactly the same who don't, and then follow them for a really long period of time. So that data is not available. We don't actually know. There's anecdotal stories of people who have talked about, living well beyond their prognosis when they do these kinds of therapies. But what we do know, absolutely, is that people will live better, if not longer. So the quality of life has really been the focus of most of our research, and helping people live whatever time they have in a better way.
How can you manage planning a proactive life if you stay in the present most of the time?
Well, that's a great question, right? So being in the present doesn't mean you're not planning for the future. It means that you're choosing to do it on purpose at certain times, right? And so planning for the future versus worrying about 18 possible terrible futures that you may have is quite different, right? So the difference between worrying is just repetitive negative thoughts, but they're actually not productive. They're not helping you plan. It's just like exposing you to, there's a good quote, right, from Mark Twain. He says, "My life has been nothing but a series of tragedies. Most of them never happened." Right? So imagining all those scenarios, it's almost like you're living them. So that's quite different from saying, oh, I want to go on a trip next week, or I need to get my affairs in order so I can kind of forget about it and live my life, right? So that kind of planning is productive. And again, you do it on purpose in the present moment. You say, tomorrow morning, I'm going to buy airplane tickets for my trip, or I'm going to organize all my bills, right? So it doesn't mean you can't plan to live your life in a structured way. It's just getting rid of that repetitive, ruminative, and really unproductive, helpful kind of repetitive thoughts. And then when you are doing your bills, you're doing it in a way that's more focused, and you can actually enjoy it more than, if you were worrying about the next thing, right?
This next question, I'm not sure who submitted it, but just know I resonate deeply with this, and I'm sure others do as well. What do you do if anxiety prevents you from getting to sleep or going back to sleep if you wake up in the middle of the night?
Oh, sure. Yeah. One of the most beloved exercises in our program is a sleep exercise. So I guess there's lots of answers to this question. So the most evidence-based treatment for sleep or insomnia is something called cognitive behavior therapy for insomnia. Okay, it's a structured program. There are apps you can do it. You look for CBTI. If you have really serious, long-lasting insomnia, there's a whole bunch of different techniques that go into CBTI to make it more effective than sleeping pills or any other kind of medication. So there's CBTI, absolutely. Within the mindfulness program, there's different breathing exercises we do that have a dual purpose. So part of the reason we can't fall asleep or we wake up in the night is because our minds start racing, right? You start thinking of all the things you have to do and you forgot to do in that email, and what if this and what if that. So breathing exercises and often focusing on what we call a body scan is just slowly scanning up your body as you breathe in and out. It distracts your mind so that you can't get into that rumination. So that's what we would call cognitive arousal. So it decreases the racing mind. And then there's also physical tension or physical arousal. So again, triggering that relaxation response through using some of the breaths we did, even that triangle breath, where you're breathing out more than you breathe in, that'll decrease your level of physical tension, allowing your body to sleep. And then the counting or the breathing keeps your mind engaged so you can't go on all that rumination. So that's a fairly simple way to just relax the mind and the body in the moment. But if it's an ongoing long-term pattern, then something like cognitive behavior therapy for insomnia could be helpful.
This is a live question. I've read that a close balance between sympathetic and parasympathetic response leads to high variability of heart rate, at least that this person's smart watch may measure. Do you have any comment on that?
Sure, sure. Heart rate variability is just it. Technically, heart rate variability is looking at the space between beats of the heart, and you want more variability. So if the heart beats perfectly regularly, that's actually less healthy than if it's faster and then slower. And so when we are balancing the parasympathetic nervous system, the person's right, you have a higher heart rate variability, which has been linked to better health outcomes. Yeah, so it does all tie together.
Sometimes my mind or our minds just go negative, and I have difficulty changing that feeling, can last all day and is very upsetting. Do you have any recommendations to help pull someone out of that negativity, that negative
Well,
mind?
the only way out is through. So let yourself go into the negativity or the thoughts a little bit is okay, right? So there's this myth, this sometimes called the prison of positivity. Mindfulness is not positive thinking. Mindfulness is kindly accepting wherever we're at. And sometimes where we're at is with a lot of fears and anxiety. And we can actually be with that and sit with it and pay attention to it. And by not suppressing it, it actually transforms and tends to pass sooner than if we try and avoid it. So it's almost the opposite. It's not about avoidance. It's about facing things head on. If it's overwhelming anxiety, again, seeing a counselor and working through some other evidence-based approaches to dealing with that can be helpful as well. But generally, facing emotions on purpose with kindness is more therapeutic than just trying to wish them away, or put on a happy face, because it's just going to pop up when you least want it to. At least if you sit down in a formal meditation practice and say, today I'm going to deal with whatever emotions are with me. You can have the cry then, you can, yell and scream or whatever it is, allow yourself to go through it in a safe container of your practice. And then it's less likely to pop up when you don't want it to.
It's really helpful. Thank you. Do
Mhm.
you recommend any of the breathing exercises that we went through today, or I guess any in general? Does it matter before or after eating?
No, it doesn't matter. Yeah, I mean, there is some, like if you look into yoga science theory, there's a lot of talk about specific breathing practice that'll help with digestion or that kind of thing. But if you're just using it for regulating your level of energy, and you can do it anytime. You're more likely to be sleepy after you eat a big meal, so you might want to, do something that's more invigorating then. But it really depends on how you're feeling and what your objective is with the practice.
You mentioned a fear of recurrence therapy. Is there a specific resource for this?
I could find one. If you look up the program I'm thinking of is called FORT, so for fear of recurrence therapy. I think there's a website, and there may even be some online programs that are available. And there is another one. So FORT is in North America. There's another one out of Australia. I can't remember exactly what it's called, but there are standardized therapies that are available at some cancer centers, and I think potentially online as well.
How does, and I know you spoke about this a little in the presentation as well, but how does stress or anxiety affect a person with cancer?
Well, that I guess I need a know what they mean more. I mean, how does it affect the actual disease? That we don't really know, but we do know from all the biomarker work I talked about is that when people are experiencing prolonged periods of elevated stress, you'll have elevated cortisol, which is a stress hormone, which can also have impacts on how well your immune system responds to inflammation or, sort of challenges in the environment, right? So it can impact biological processes. The link between that and disease progression is the one that's not clear cut. We don't really know exactly if that's helpful, but
A lot of questions about scanxiety, waiting for scan results, and steps to take to reduce that anxiety.
yeah, that's a really good question, right? Because you see this pattern as soon as it's creeping up, the anxiety. And why? Because it's bringing to mind all those what ifs, what if, what if, what if, what if, right? So I think just trying to remind yourself that these are things you can't control. This is information that you just don't know how it's going to pan out, and don't cross that bridge until you need to, right? And that's often a phrase I use. It's like, I'll cross that bridge if and when I need to. And often I find that people who go through our programs have more of a mindset that, yeah, I don't know what the future holds, and every test, every scan, every visit could be bad news, but they feel more equipped to handle it. Like they say, I don't know what the future is going to bring, but I'll know I'll be okay, right? Because I've got all these tools to deal with symptoms, to deal with fears, to deal with anxiety, and whatever the future holds, I'll get through it. I think is often the attitude that people have after they learn all these skills and tools.
When our minds might be spinning out of control, what do you say is one question we should ask ourselves to help bring us back to center?
Your mind's spinning out of control. One question. Well, hmm. I mean, I guess reminding yourself that these are just fantasies, they're not reality, right? Like all these things we build in the future, like all these possible scenarios, most of them aren't going to happen. And the things that do happen are going to be something else that you never really even anticipated. I guess one question is, what's wrong right now, or what's right now? Like, what's my experience right now in the moment? So trying to not go to all those possible future scenarios, but focus more on your experience in the moment. I guess one exercise people often do is grounding in the body and in the moment, so feel my feet on the ground. Often there's these ones like what colors do I see, what smells, but really just coming back into your senses, I think, is the idea. And rather than this, being so caught up in your mind with all these possible future scenarios. And as I said, it's almost as if they're happening when you're imagining all these terrible things, right? And most of them never will. So I think trying to ground yourself more in the moment, and let go of fantasies of the future that aren't reality, right? Your only reality is here in this moment. And why ruin the present because of some possible future that will probably not come to pass, right? So I don't know, if a question to ask yourself is, can I be present right now? You know, I think checking in with the senses. What do I see? What do I smell? What do I feel? What do I hear? And just re-engaging in the moment is probably the best strategy.
Dr. Carlson, one of my favorite takeaways from your presentation today was when you said mindfulness is being a human being, not a human doing. So thank you for that. May we all go on to be better human beings. Thank you all for attending today. Dr. Carlson, thank you for your time. We really appreciate it. And everyone, I hope you have a wonderful rest of your week. Thank you again for joining us.
Thank you so much for attending.